The 4 viruses linked to autism. Dr. Megan Pesch, a pediatrician at a children's hospital in Michigan, has grown increasingly aware of the severe impact that cytomegalovirus, CMV, can have on newborns. CMV is a relatively unknown but surprisingly common herpes virus. According to the NHS, about 1 in 200 children in England are born with a congenital CMV infection they acquired in the womb. This virus can invade the brain, and approximately 1 in 1,000 children develop lifelong disabilities as a result, with hearing loss being the most prevalent. Dr. Pesch's recent study revealed a more significant, long-term consequence of congenital CMV on brain development. By analyzing the medical records of over 3 million children in the US from Medicaid and the Children's Health Insurance Program databases, she discovered that these children are 2.5 times more likely to develop autism later in life. CMV is an incredibly destructive virus, Dr. Pesch explains. In the womb, CMV attacks and infiltrates the placenta, reducing blood flow and nutrients. It's also drawn to the fetal central nervous system, where it infects early brain cells and alters brain development. Dr. Letitia Davidovic, a research director at the French National Center for Scientific Research, emphasized the public health implications of these findings, suggesting that they highlight the need for systematic CMV antibody testing during pregnancy and at birth. Which viruses are associated with autism? Rubella is perhaps the most recognized virus linked to autism. Contracting rubella during the first trimester of pregnancy can lead to various forms of organ dysfunction in the fetus, with the autism rate in children born with rubella being more than 200 times higher than in the general population. Like CMV, rubella can invade and replicate within fetal brain cells. Other neurotropic viruses, which can invade the brain, such as Zika, a mosquito-borne tropical virus, are also suspected of contributing to autism risk by affecting brain development. Children born to HIV-positive mothers are 3 times more likely to be diagnosed with autism, develop mental delays, or attention disorders. However, not all viruses need to directly invade the fetal brain to cause issues. Genital herpes, a sexually transmitted infection present in about 15% of women of childbearing age, has been shown to trigger inflammatory molecules that alter fetal brain structure, leading to abnormal growth in the cerebral neocortex, which is responsible for attention, thought, perception, and episodic memory. A Norwegian study found that male babies born to women who contracted genital herpes during the first 18 weeks of pregnancy were twice as likely to develop autism. Other research has indicated a higher risk of autism, intellectual disabilities, and schizophrenia in children whose mothers were hospitalized with influenza during pregnancy. This raises questions about the connection between inflammation and autism, especially in fetuses with genetic predispositions toward autism, says Dr. Pesch. How can viruses affect brain development and function? In some cases, viruses like CMV can cause direct harm to the developing brain. For instance, some fetuses with severe congenital CMV infection suffer severe brain injury and may not survive the pregnancy, says Dr. Sarah Mulkey, a prenatal neonatal neurologist at Children's National Hospital in the US. In other cases, the impact of viruses on brain cells is more subtle, altering their behavior rather than killing them outright. These changes may involve how brain cells form connections or organize themselves as the brain grows. Dr. Pesch notes that these alterations are not always visible on brain scans. CMV is also capable of regulating certain genes, preventing the brain from developing its characteristic folds, leading to developmental delays due to a smaller brain surface area and fewer cells. There is a gene that CMV can suppress in the fetal brain, and when this gene is knocked out, it can result in a smooth brain, she says. CMV truly alters how brains develop. Some congenital viral infections may also affect the developing baby's microbiome, which in turn influences the brain through the gut-brain axis, the communication networks that connect the brain and intestines. At a recent conference, Dr. Mark Schleiss, a pediatrics professor at the University of Minnesota, presented research showing changes in the gut microbiome of babies with CMV. How inflammation and the immune system affect the baby. It's now understood that a virus doesn't need to infect the fetal brain directly to cause harm. The higher autism rate seen in children of mothers who were hospitalized with an infection may be due to widespread inflammation in the mother's body, known as a cytokine storm. When the mother's immune system produces high levels of inflammatory molecules called cytokines, these can reach the fetal brain and disrupt its development. This is also why pregnant women with autoimmune conditions such as Sjogren's syndrome and rheumatoid arthritis are more likely to have autistic children. Chronic viral infections, such as HIV and genital herpes, are linked to autism through their impact on the immune system. The immune system can produce autoantibodies that mistakenly attack the body's own tissues. Between 10 and 12% of mothers of children with autism have autoantibodies. One theory is that viruses like HIV and herpes, which embed themselves in the DNA, can overstimulate the immune system, leading to the production of autoantibodies that attack the developing fetus. Viral infections can activate the maternal immune system, prompting it to produce autoantibodies, Dr. Pesch explains. These may cross the placenta and target the developing fetal brain. What can be done? Dr. Davidovic stresses that these findings underscore the importance of vaccinating all pregnant women against common viral infections like influenza and rubella to reduce the risk of autism and other neurodevelopmental disorders. She also emphasizes the need for education on hygiene practices to prevent CMV exposure, such as regular hand washing and avoiding sharing drinks during pregnancy, as CMV is present in body fluids like saliva and urine. Dr. Pesch's research also highlights the need for a CMV vaccine, which may soon become available, with companies like Pfizer and Moderna reportedly working on one. For pregnant women with genital herpes, doctors recommend taking antiviral medications to reduce the risk of the baby being affected. Antiretrovirals are crucial for those who are HIV positive. Dr. Blake Turner, a psychiatric epidemiologist at Columbia University, agrees that, in theory, vaccines against common pregnancy infections could significantly reduce autism rates. However, given the complexity of autism and other factors like genetics, diet, and environment, the issue may be more complicated. Dr. Pesch hopes her findings will raise awareness among healthcare providers and the public about the potential risks of maternal infections, leading to better monitoring and screening of pregnant women. Given the numerous connections between the gut and the brain and the possibility that these infections could disrupt brain development by altering the microbiome, Dr. Pesch has started recommending probiotics for toddlers as a potential preventive measure, though she acknowledges that this approach is not yet evidence-based. It's just a shot in the dark, she says. But it certainly won't hurt.